you said, your team coming in, helping rural health centers and other communities, figuring out how you guys come up with an action plan to meet the mandate together. So they're not just all alone, because they're just not going to do it on their own. So that makes sense. So I want to kind of pivot a little bit. Let's talk about yourself as a technologist, as a consultant. I mean, look, you were in the forefront of telehealth before anyone knew how to spell it, right? And so I would just be curious. Someone saying, hey, I was at a recent insurance conference, the AHIP, last week, and a lot of Medicare Advantage commercial plans, they said utilization went from 100% during the pandemic down to 20%, right? And so the utilization for telehealth has dropped tremendously, after, people are going back seeing the doctor in person, and we're still running into the same issues, right? The staff is just overburdened. People are missing appointments. It's just the same kind of workflow. From a consultant standpoint, what are you seeing are some best practices to have a successful telehealth program that can be useful and sustainable for the future?
These days, being cost conscious, that's a plus there. There are many more options than there ever were. You can spend a tremendous amount of money just on the technology side, but there's technology that will do the job. And if you don't go in with the world's largest spend on the front end, and I'm just talking about hardware and technology wise, I think spending in planning, getting your workflow down, doing discovery of exactly what you want to do. I mean, going through the process and planning, I think it's hugely important. Very old concept of, I'm going to put enough budget number on this and go my facility a large box of telemedicine, and bang, we're going to drop it in, so telemedicine's going to work. That's far from true. You can't run the programs that way, and a lot of them were in the beginning. And I've seen lots of closets and basements full of very expensive telemed hardware.
The fix isn't more automation. It's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about the healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.